phrase. So I know you guys are nurses, but I'm going to take you back to fundamentals here. Can you see this okay?
Yes, ma'am.
Okay. So you've probably seen something like this before. This is just a diagram of the human heart.
Right.
And the heart is kind of like a house.
Right.
You've got 2 rooms upstairs. You've got 2 rooms downstairs. You've got hallways. And then there's 4 doors connecting all these structures, and they're kind of in a row. 1, 2, 3, 4. It's not as simple as this diagram would have you believe, but it's good enough for practical purposes. Right. And blood, when it moves through the heart, is supposed to be a one-way street. If you turn the wrong way up a one-way street downtown, everyone's going to be really ticked off at you, and your heart is no different, right? Blood is supposed to come here through the vena cava into this room right here called the right atrium. With the next beat of the heart, it goes through this door to the right ventricle. And then with the next beat, it goes through this valve here and out this hallway. And then it travels to the lungs, which sort of flank the heart on either side. It's a little more situated to the left than the right, but you don't need to know that. They're just kind of over here. In the lungs, blood picks up oxygen and drops off CO2. That's the whole point of breathing. It's the whole point. Oxygen is like fuel. It's like gas for your car. And if you're trying to go up a hill in your car, in a steep hill, you have to squish that accelerator a little more to give it more fuel to get it to go. Well, your body is no different. If you're standing up, if you're doing dishes, gardening, running a marathon, doesn't matter. You need more fuel. So in order to harvest that fuel, blood goes to your lungs. When it comes back from your lungs, it comes here from the pulmonary venules into the left atrium, and it passes through this door into the left ventricle. And you can see the wall around this room of the heart is a lot thicker than it is everywhere else. That's because this is the pump. Everything else mostly fills passively. I'm sure some of our cardiologists would kill me for saying that because it's a lot more complicated than that. But really the powerhouse of the heart is this one here. And then when this chamber squeezes, it moves that blood out through this last valve, which is like the front door of your house, out to the aorta, which is kind of like your front porch. And from the aorta, it sends that blood to your brain, your kidneys, all your vital organs, even the heart itself, to give it that fuel that you need in order to not only live, but thrive. You have to have oxygen in order to do stuff. But unfortunately, your fuel injection system is busted. So I'm switching metaphors between cars and houses. You'll have to excuse me. But
it's visual, and to help you understand.
It does. It does. So this here is very narrow. And if you think about a garden hose, if you've ever turned the water on, you know, you get a nice clear stream coming out of that hose. But if you put your thumb over it and make that hole smaller, flow increases, but so does pressure. So you end up with less water coming out with way more force. And that's exactly the same thing that's happening with your aortic valve right here. It's called Bernoulli's principle, if you care so much.
So that's basically where the new valve goes.
That's right.
Okay.
So this is what a healthy aortic valve looks like. A healthy one has 3 leaflets. Yours does. Some people are born with 2 of these leaflets fused, but you lucked out. You didn't fall into that 2% of people. You have a tri-leaflet valve. When it's closed, these leaflets meet in the middle and prevent blood from going the opposite direction, like what happens downtown when you're supposed to not turn up a one-way street. And when it's open, you get this big, large opening here that blood can flow through appropriately. But unfortunately, yours looks something a little like this now. When it's closed, the leaflets may not meet in the middle anymore, and when it's open, it certainly doesn't open very far. This is caused by a buildup of calcium. And calcium builds up everywhere. I mean, it builds up in your pipes and your shower head. If you've ever had to CLR a shower head, it happens in your body too. It causes a lot more trouble in your body because we can't just pop the shower head off and replace it, right? But this calcium builds up over decades and decades. And then eventually it gets to the point where your body just can't compensate for it anymore. And then you may start feeling things like fatigue, activity intolerance, shortness of breath. Some people start passing out. Some people need oxygen at home. Some people actually start having lower extremity swelling. Because
she had it.
Yeah, because
she had it, and she was on oxygen at one point, but she had that flash pulmonary edema.
Right.
And when that was resolved and she came off the vent, we thought it's over.
Yeah.
Just
you
saying.
showed them, didn't you?
She's been doing
They
that
don't
for
call her
years.
the
Yeah.
pit bull for nothing.
Good, I
And
like
then
it.
Her brother says we have that I must have 9
Nine
lives,
lives.
but something like I've already.
You've already done 12.
You
You've already
used-
used
yeah.
12 of them. Well, pass that luck on over to me because
Yeah.
they call me something obscene when it comes to my luck. It's terrible. They
No.
call me the something explicit magnet because my luck is awful. So anyway, I'll have to rub your nose for good luck on the way up. But that's basic. That's the basic patho of AS. So the question now is, how do we fix it? 2 ways. Come in. Hey,
Hello.
come on in.
I'm Dr.
Hello.
Alapati's medical student,
Hi, come
Ellie.
on in. I'm Meg. I'm a nurse practitioner with the
Oh.
structural team. We are going over
Hello.
AS and TAVR and all that. I'm happy to pause and let you take over. Or you're welcome to hang out and learn a thing or two
I have
about
to do a
AS as
neuro
well.
exam, so you go ahead.
Awesome.
It'll take longer.
Okay.
You're
So,
on.
so that's the patho of AS.
Mm-hmm.
And again, we don't really know why some people are more prone to developing these calcium buildup than others. Sometimes it's familial, like if you have a bicuspid valve, it forms a scoop-like thing that's sort of that turbulent flow, just collects calcium more than others. Yours is tri-leaflet. I think you just ran out of luck on this one.
Well,
Sometimes people get it, sometimes people don't.
yeah. Well, it would kind of be my luck to get to run out of
You know,
something. But
no, your luck is that you get something we can fix.
Your luck is that you're here and they found this.
And
Yeah.
your luck is that you've got Gotham Reddy, who will overlook everything that other people will not, because he really is. He's a phenomenal physician. So how do we fix it? 2 ways. One's with open heart surgery. That's where we go in, crack the sternum, cut the old valve out, put a new valve in, sew you back up. Hopefully you're in the hospital for about 5 days. You go home. You're a terrible candidate for that. This is not something we would do for you just because of age, but also you've got severe coronary artery disease, you've had flash pulmonary edema in the past, you've had every type of cancer under the sun. No one's going to touch you with a 10-foot pole when it comes to surgery, right?
Okay.
So what we do instead is something called transcatheter aortic valve replacement, or TAVR,
Which is what that
which
was.
is what this is. Now I have 2 questions for you. Are you sensitive to any metals? You ever broken out in a rash or anything when
No.
we put jewelry on you?
Mm-mm.
Okay. The reason I ask is because this cage of this TAVR is made of cobalt chromium. It's 15% nickel, and some people are kind of like itchy to nickel, so we have to know that in advance.
No, I've never, in 88 years almost, I
Good.
don't ever notice anything. like
Perfect.
that.
Are you sensitive to beef?
To beef?
Mhm.
No.
Oh, okay. You'll be part cow after this procedure, which is why I asked. Because if you're sensitive to beef, then we have to put a pig valve in. But we have the best results with
I'd
the
rather
bovine
have the
valves.
bacon valve. Wouldn't you, Charlotte? Wouldn't you rather have the bacon valve?
Yeah. But, you know, we've got to do what's
Do what we
fair.
gotta
That's
do,
right.
right?
That's
Yeah.
right. Brisket
give 'em-
instead of pulled pork this time.
There you
Just
go.
have to fix more.
Okay.
Okay.
So this is a transcatheter aortic valve. This is a 26 millimeter Sapien S3 Ultra.
Mm-hmm.
And this is a model. This is not the real valve, but what we have here are leaflets. And these leaflets are made up of cow pericardium. They're made up of the fibrous sac that surrounds the heart on all mammals. You've got one too,
Mm-hmm.
but we don't go hunting people down and taking their pericardium. We take cows. It's a byproduct. They're Holstein steers. They're raised either in Australia or California. We don't just go down to Jones Valley and pick one out of a field. These are actually medically raised cows.
Oh my gosh.
And when they're slaughtered, the pericardium is taken. Edwards puts them through a very, very secretive process on how to process them. It's laid out, and then a computer scans it with very, very minute tolerances. Out of a whole pericardium, which can be about this long, they may get 3 or 4 leaflets out of it.
Oh, my goodness.
And
Wow.
leaflets are this big. So the way we put this in is this is not this size when it goes in. It's collapsed around a catheter. The catheter is inserted into your groin. We go up through the iliac artery to the femoral artery to the aorta, and then because that valve is the very last structure that blood leaves before it goes to everywhere else, if we trace that in reverse, it's the very first thing we come to when we feed this up through there. So with this collapsed, we push through the valve, and then the balloon is blown up, and this valve then pushes your native leaflets out of the way and sits in there just like this.
Is it a permanent thing?
It
or
is.
Does it ever have to be, not that I'll live that long to find
Yeah.
out, but is it ever replaceable?
It is.
Okay.
You want to know how we replace it?
Well, no, I guess I better though ask, just in case I do live to 100.
If you live to be 107, we just put another one in. We stack these like solo cups. We take a 25 millimeter and pop it right in and do the exact same thing twice. It's
Okey-dokey.
called a valve-in-valve TAVR, and we do them all day, every day. So, super
Wow.
cool. Let's talk about risk, benefits, and alternatives of this procedure. Major risk of TAVR is stroke, because the calcium that's immobilizing those leaflets, sometimes when we inflate the new valve and those old leaflets are pushed out of the way, every once in a while a piece of that will flake off and go to the brain. It happens at about 2 to 3% of TAVR patients. That's the national average. We're on par with that here at Huntsville Hospital. For a while our rates were a little lower, and then we kind of got jack whammied. I don't know what happened. We had a bunch of strokes, but the patients did fine and recovered well. Part of the CT that we got, we're able to do a 3D rendering of your aortic valve. So, and we can calculate a calcium score. It's called a Gaston score. And if it's super high, or if we think your valve is high risk for stroke, there's actually like a little fishnet we can put in through your arm. So the valve goes in first, and then the fishnet comes in behind it. It's called the Sentinel device. And then when we inflate the valve, it catches all that debris, and then we cinch it up like a coin purse and pull it out. There's risks associated with using the Sentinel device as well. We can always disrupt calcium in the aorta when we do that, so we don't use it as a matter of course, but we do use it for cerebral protection if it's indicated. Other things that can happen, there's anywhere from 2 to seems like 4,000% chance you may need a pacemaker, but you don't have high risk features for that. The electrical conduction system of the heart is neighbors with the aortic valve. And sometimes when we inflate that valve, it encroaches on the property line a little bit, and then the left bundle branch gets really mad and just stops working. So if you have an existing bundle branch block or sinus node dysfunction, you may be prone to a pacemaker. But if you need one, we just pop it in the same day, and you still discharge. Procedure takes about 40 minutes. You check in on the 3rd floor, we do some labs, we get a chest x-ray, procedure's done, we return you back to that unit, and then you stay overnight, and then you go home the next morning.
Really?
Yeah, it's almost an outpatient procedure, and sometimes when we get people in really early in the morning and we watch them, sometimes we send them home late at night, but usually we like to keep you. You can have bleeding at the insertion site, usually not a problem. Are you Jehovah's Witness or have any exemption to receive blood products? Okay, good. I got a whole vending machine full of blood on the 1st floor, so I wouldn't have to worry about that. I would just go in and punch it and bring you a unit.
No, anything wrong with my blood, as far as I know, is I'm Rh negative, which is a pain and bleeding.
Yeah, it is. Big scary things that could happen: loss of limb, annular rupture where the heart tears and you end up with a big pericardial effusion, debilitating stroke, loss of life. These happen far less than 1% of the time, but I don't want to say I never told you it could happen.
That's true.
So,
well, every surgery or stent or anything that I've ever had, I've been warned. Well, So I'm so far so good.
Yeah.
So if it would just help me have a little bit more oomph in my life, that would be that's worth taking the chance for.
I think it is, especially since the risk of these things occurring is so low. There's a slightly higher risk of getting like an annular fissure, where sometimes when we implant that valve, you get just a little tear as opposed to a big rend. And when that happens, you can have what we call a hemopericardium, where you have blood in the sac around the heart. If that were to occur, we insert a small tube. It stays in for a couple days till it seals off. Then we take it out and you go home. But by and large, TAVR is very safe. It's tolerated well. And the number one phrase that's uttered at our follow-up clinic with Christy Canty, she's our nurse practitioner on the outpatient side, is, "I didn't realize how bad I felt until I got this valve replaced." Now, there are some people that don't feel better after TAVR, and those are the people whose symptoms were not caused by AS, like we talked about. But by and large, most people have been brushing their symptoms of AS or attributing it to other things, and they get the valve in and they go, "Holy smokes, I should have done this years ago." And they probably should have done it years ago. So just things to think about.
Yeah. Well, so far so good. I mean, as I say, I'm old as the hills, but I still want to hang around a while.
Yeah, you seem like the type that should.
She's got more traveling to do.
That's right. That's right.
We've got a cabin sitting up in Chattanooga for the 11th.
You gotta do it.
Yeah, for her birthday.
Well, we'll yeah.
Yeah.
All right. Well, I have a video to show you. It's 3 minutes. Do you have time?
Yeah, I do.
Okay. So this is